Okay, good evening, everyone. Thank you for making time to be here tonight. My name is Dan Hicks, Prevention Services Manager with Ventura County Behavioral Health, and it's my pleasure to welcome you here. I wanted to take care of a couple of housekeeping items, and those include interpretation services. If you are someone who needs interpretation services, you should have one of these. And if you don't, you need to go out to the front table and get yourself set up. Oh, sorry, here with Ignacio, right here, you can get them.
Bienvenidos, muchas gracias por estar aquí. Queremos empezar preguntando si alguien necesita servicios de interpretación. Si puede levantar la mano y mi compañero aquí va a poder pasar a dejarles sus audífonos para que puedan escuchar y la interpretación de la sesión.
So Coast Ventura County is a collaboration of multiple agencies and community interests, and we're so glad you're here tonight. One of the things we want to underscore is that your thoughts and your questions are welcome. We have an esteemed panel, and we want everyone to feel comfortable. There are microphones set up here. We'll hear more about that later, but please join us in a town hall style discussion.
Ok, entonces les vamos a empezar y dar inicio. Tenemos muchas personas que están aquí en este día donde vamos a estar hablando de un tema muy importante para todos. Entonces, por favor, se sientan cómodos y puedan poner toda su atención para toda la información que se va a dar en este día y les agradecemos su asistencia.
And finally, I'll invite everybody to take advantage of the resource tables in the lobby and just outside. Please do take advantage of that. If you didn't get a chance to now, you can do so at the conclusion of our program.
Y si no tuvieron tiempo de visitar nuestras mesas de recursos que están al inicio, van a poder hacerlo al final de nuestro evento. Por favor, pasen por cada mesa porque tenemos información muy importante que les puede ayudar y puede beneficiar. Así es de que si no lo hicieron al inicio, lo van a poder hacer cuando terminen.
Thank you. And now at this time, let me introduce our Division Manager for Substance Use Services, Ventura County Behavioral Health, Raina West.
Thank you everyone. Good evening. Thank you for being here. So on behalf of the Behavioral Health Department and Coast Ventura County, I'd like to thank the panelists and the subject matter experts who are here, but most importantly, I really want to thank everyone who's here, the community. Without you, we couldn't do any of this, and it's this collaboration that everyone has here together and the importance of this issue, working together to combat it. Thank you. Now it's my pleasure to introduce Gabe Turan, our moderator for the program. Gabe Turan is a 20-year professional in community advocacy work. He's a subject matter expert in the fields of substance use prevention and youth development. Gabe has provided direct services to young people his entire career, many coming from historically challenged communities. Gabe holds a Master's of Science degree in Management and Leadership and is a certified substance use counselor. Please give a warm welcome to our moderator tonight.
In numerous capacities, including athletic coach, social science teacher, assistant principal, and now Director of Student Support Services. So thank you, Ray. Next we have Dawn Anderson, RN. Dawn has over 20 years experience as a credentialed registered school nurse. She's the president of the California School Nurses Organization and is currently working her dream job as a credentialed school nurse for the Oxnard Union High School District. She has a Bachelor's of Science in Nursing and a Master's in Educational Administration and is a Johnson & Johnson School Nurse Leadership Fellow. She has participated for many years as part of that is on the index cards, or if you choose to do so at the mics, give yourself space and permission to do that as well. We are all here to learn and to listen. But also be willing to give space to others. Others may be here in a learning capacity. They may be wanting to get information they've been curious about or that they would like to have as a result of being here tonight. So we will ask that we allow space for others to ask questions if we've already had the ability to come up and ask a question. All right, so as long as we're all good on the same page with that, I think we can move forward. All right, so we will start in our Q&A portion here. Our first question here, just to get us started, I'm going to start on our with our EMS here with Jaime Villa.
Without that, we would lose valuable time to help our students. So having that on campus has been, it's been a reassurance. I haven't had to use it. Like I said, we have altered level of consciousness, and you only give it when someone's completely unconscious. So at our school sites, we haven't had to give it, but it's been a really great, item or tool that we can have available when we do need it.
Thank you, Don. And I will just round out that question by reminding folks that Don said it perfectly. It's another tool, another option to have in case it's ever needed. I would imagine you could look at it as I'd rather have it and not need it rather than the other way around, right? And it wouldn't just be for students. We could have staff who were accidentally exposed or a visitor in the parking lot. And if it's there, the sooner they get back to a closer respiratory rate, a regular respiratory rate, and emergency services arrive, the better outcomes for them. So thank you.
And I have had it where I've had the kit sitting next to me with the box open, waiting for emergency personnel, trying to keep the student awake. So I haven't had to use it, but there has been times that the box has been open and ready for use.
Yes, thank you. Oh,
I think
go ahead.
Mine works. All right.
Yes.
As she's talking, I think one of the important pieces of why we're doing what we're doing tonight is to raise awareness. And the reality is, I think for a lot of people, when you're talking about Narcan, you think about, right, it's only at schools, only law enforcement has it, or you're only able to get it at hospitals or, places like that. And the reality is the more that we can make it aware and get it in people's hands and get them comfortable in talking about it and realize that, right, I know for me, like all of my family people, I have it in every glove box of my car, every person that I know that, right, interacts with the public in some certain way, right, has access to it. And everybody should. There's no reason that there shouldn't be anybody, at least, of course, in this room for sure, right, but really in the community that has it, and should feel comfortable using it, right? Because as I go out, there's been many times where I've gone out and seen people right on the streets as I interact with a lot of the homeless population, right? And seen people right on the nod or in active, right, overdose. And so it's those times that you have that and are comfortable using it, right, that starts saving lives. And that's a big piece of that is I think people feel like, right, oh, I can actually get it? I didn't know that it's actually accessible, or I don't know where to get it or who to ask. And so they just don't ask. Right, and a lot of times, right, that's, again, a potential life that we don't save. So it's important that we talk about it and get access to it. Great.
Thank you, James. All right, the next question, we're going to go into our treatment sector. And so this question is probably best addressed by Ruben. A lot has changed over the last few years with opioids and addiction. We have heard how powerful the synthetic stuff is. How much heroin do you see coming into treatment versus fentanyl? And is treatment basically the same for those two substances?
Since fentanyl came on the scene, heroin pretty much disappeared. We hardly have any positive tests for heroin now. It's all usually meth and fentanyl. Treatment's the same. The state just passed a thing that on intake, we could take them up to a higher dose now as long as our NP and our doctor approve it. Before, we're doing a 20-20 split dose of methadone. The average holding dose for fentanyl is 80 to 120 here in California. I know in Florida, they're up to 240. So with having that leeway to get them in a higher dose, when they're coming in, it's more likely to keep them in the program and keep them coming back if they feel some effect of the withdrawal symptoms lessening when they intake. And basically, the treatment's still the same. It's just their doses are a little higher because the fentanyl's so strong. So we increase them, get them off the fentanyl, and then once we get them stable on methadone, we start decreasing them off the methadone.
Okay, thank you. And along those lines, I don't know if, Ruben, if you'd like to take this one or if we want to have our subject matter experts jump in on this as well. But can you explain a little bit about medicated assisted treatment and the concept around that? And you'd mentioned methadone and having these opioid replacements. Can you share a little bit about that?
The methadone, what it does is it helps ease the withdrawal symptoms as they're coming off. And we also do counseling. We do substance. We do social. We do vocational. So we help them get stable in all the structures of their life because everyone can be a trigger. So when we get them on a methadone dosage that's stable, then we start working on them. We refer them out to doctors, get them healthy. Basically, we treat the whole person and not just the addiction. So we try to get them stable in all areas, like I said, because every area is a trigger. And the only way you're going to get clean and stay clean is if you're stable all the way around.
Yes, thank you. And do any of our subject matter experts want to chime in a bit more on MAT or some of our emerging items we have as well?
Sure. So I'm Joe Blaskowitz. I'm the Medical Director for Substance Use Services at VCBH. In addition to the methadone, we have buprenorphine, also known as Suboxone, available, which is a little bit different than what the methadone clinics do because those are take-homes. And we're trying to expand that in the county. There's multiple different sites that have that. On top of it, we now also have long-acting injections that last for 30 days. Brand names are Sublocade and Brixadi that we're trying to get out there. So one of the big things that we're trying to do is have as many options as possible for our population and get people into treatment and, as Ruben said, keep them stable and get them into therapy. And these are proven methods in order to help people. I just want to underline that.
Thank you. And real quickly on that, there is a follow-up question. Are there fentanyl detox locations or are there opioid treatment programs or detox locations folks can go to in the county, or recommendations on how someone can find that information?
We also do detox at our clinic. We do a 21-day detox. They'll come in. After that 21 days, if that does not work, then we can get them on maintenance. And we also do take-homes, too, with the methadone. SAMHSA changed the thing with under Title IX. It was 3 clean UAs to get take-homes. Now with SAMHSA, after the first clean UA, they can get a week of take-homes, and they work their way up to a whole month of take-homes.
Sure.
And
a UA is a urinalysis.
Yes. And we also do Suboxone, too. But to get on Suboxone is different. You have to have nothing in your system to get on Suboxone.
Okay. Yes.
Detox, also referred to as withdrawal management. We have several locations that we offer that. For youth, we contract with Tarzana Treatment Center, which is in Los Angeles County. And then we have in-county, we have adult facilities. And that's Kepper House, which is here in Ventura, and Prototype. Kepper House is for men. And then Prototypes is for women, and that's here in Oxnard. And Tarzana Treatment Center also is in LA County, and it serves adults as well. And the way to access that is through our access line. And you can find these on the resource tables out in front. And what will happen when you call those lines is they'll do a screening. And research shows that better outcomes come when they're matched to the right level of care. So you'll get a screening, and you will they'll look at your current symptoms and behaviors and match them to the correct level of care. So you can get these forms out there on the resource table. And then also, we have BCMC also offers 3.7, which is a higher medically monitored level of care. You can also find these flyers outside on the resource table as well.
Thank you. Okay, we're going to jump just a little bit back here into education, but it's more prevention in general, and I think any of our panelists can do this, but I will start with Ray. With prevention, in schools, what are we doing preventatively for students to hopefully never even start using substances? Do we have programs or funding sources from the state that allow us to be able to be preventative in the information we give to students?
Within our system, all freshmen in particular take a health class that first year. Within the health class, there are lessons and units built around education around substance abuse, the negative impact on the health of a person, social-emotionally as well as physically. We've also been proactive, and I believe we have been working with the sheriffs who did like a PSA type video, and we've been able to show it to all of our schools school-wide about obviously the negative impacts of fentanyl on people and the problem of how it can take your life in such a quick fashion. And so we've been able to show that at all our schools to all of our students. And so that is a few of the things we do around prevention.
Great, thank you. And then, do you have something, Don? Okay. For anyone else on the panel, when we look at the general public, like for EMS, for example, what kind of preventative items would you maybe see in your lane that might be able to help provide prevention information or information to people who you think may be at risk, or maybe have a family member who's at risk of fentanyl use or even overdose?
So on the EMS side, most of our interactions tend to be more in the lane of the emergent, but when we do have opportunities, one of the programs that we've initiated along with the county is a leave behind program for Narcan. And the preventative side on this is that these are folks who are typically going to sign out AMA. They won't transport to a hospital. And they get a very short follow-up class on how to do CPR, and they get handed some Narcan, and they get some other resources that'll actually steer them towards the available resources within the county to be able to do some follow-up. And a big part of that has to do with trying to capture other folks who may be in the household, who may be using, or other folks who you may have pediatrics in the home that we want to identify. And so from a prevention standpoint, we try to stop the next occurrence from happening on the EMS side. One of the emerging programs that we're very excited about that's coming towards us is a bridge program, a buprenorphine program where EMS providers in this county will be able to provide that on site and be able to give a dose right after a patient has been reversed, with a follow-up dose that'll allow them to have a little bit of a transition period to get them into treatment. And it's had really good success, something to 20 to 30% success rate in Northern California, and that's starting to roll out across the state.
Thank you.
I do see we have a question up there, but I just wanted to finish my thing, but I do see you, so I'll make my comment quick. I do, to add on to Mr. Gonzalez's, for prevention, one of the other really strong components is prevention is not just talking about, substance use and prevention of substance use, but it's also talking about wellness. And I think our schools do a really great job about teaching and having classes. Our wellness center does this on a weekly basis, has classes on, self-advocacy, how to be well, how to stay well, and really looking out for yourself as a person, and not always just focusing on the substance use part. It's a combination of that, that we know that there might be something missing for that student that leads them to use, and what could that be? So really looking at the whole student, and making sure that we're lifting them up in all areas, and looking at that wellness. So we do a great job doing that.
Great, thank you. And my apologies, I hope you weren't standing there long. I have the light shining in my face, so thank you. Go ahead if you have your question.
Hello, hi, my name is Crystal. I'm from Oxnard. I have a family member that I care for that has a mental health condition, but also dual diagnosis, so she struggles with substance abuse. And she's cycled through the system where she's been at facilities and treatment centers, but then the most that she's been there is 2 weeks, and then they release her. So I don't know, does Ventura County have long-term treatment for those who need it? And personally, as a family member caring for someone struggling in that situation, I think that it's a lifestyle change for someone struggling with addiction, and 2 weeks is not enough. What does Ventura County have to offer?
Thank you. We have our behavioral health representatives down here. If the panel's okay, I'd like to defer to them on that one, if that's fine. All right.
I think what you're talking about is a tragedy. Sorry. And the problem is that we're limited by, in terms of involuntary treatment, by the law, okay? And in California, and California has one of the strongest patients' rights regimes right now. In order to commit somebody, you can't commit them for substance use. Now, the legislature changed that law, which we had to postpone in our county because the facilities don't yet exist in order to do involuntary treatment of substance use. But in 2 years' time, or within 2 years' time, there's the hope with that and the recently passed Proposition 1 that the facilities are going to be more available in order to do that. But it's something that I, as a psychiatrist, I can tell you, we see this all the time, in which it is the commitment criteria are so high presently, and involuntary treatment is so difficult to reach. It is a major problem that's a social problem. And I have nothing but empathy for you and the families that have that. And those of us at the front lines deal with this on a daily basis. And I wish I had more to say, except that it's been recognized at the level of the state, and there's changes coming, and legislation has been passed in order to address that. And I wish I could tell you more.
I appreciate it.
Does that help, kind of?
Definitely, yeah. I've seen a lot of change in Ventura County, and I appreciate that. The other question I have is there any way for the community to be more involved in the development of locally developed programs for opioid awareness and prevention?
Yeah, so that's a great question, and what I could say is we absolutely need involvement from the community. Part of, as Dr. Moskowitz mentioned, the facility types, especially on the substance use side, don't currently exist. And so we need to build out the infrastructure in our county, just like all the other counties who had to defer. So 56 out of 58 counties in the state had to defer implementation of the bill, which is known as SB 43. So we need advocacy from everyone at the local level so that we can build these facilities and get through the red tape of actually providing the care in our community. And so that's where we would need folks talking to your local officials. Please talk to your folks at the city, talk to your state representatives, because until we can get the actual infrastructure, we can't provide the treatment services. So that's where we really need very loud voices from the community to support our efforts.
Thank you.
Thank you for your questions. All right. One question we have on their next one here is going to stem off of something we saw in the video and in the presentation. And then I see we have someone lined up. We'll go to her after this, or go to them after this. So the question here is, what is the extent of fentanyl contamination in other drugs, such as marijuana? And do more overdoses occur through unintentional fentanyl use because other substances are contaminated or laced with it? And I'll leave that to our panelists, or I know we have some folks from the front lines down here as well. What is the extent of fentanyl contamination in other
Pretty much
substances?
on the clinic level, we've witnessed it in anything you buy off the street that could have fentanyl in it. From pills to marijuana. Like the lady was saying on the panel, there's no confirmed overdoses of fentanyl and marijuana. But we have had overdoses of fake Adderall pills, Xanax pills that were all laced with fentanyl. And with the test strips the county provided us, we were able to test them in clinic and let the patients know that there was fentanyl in their pills.
Thank you. That's another question. Are there test strips for fentanyl? And you just answered that, right? Great, thank you. Anything else anyone would like to add to that?
I will tell you, on the first responder side, we do tend to deal with what we call polypharmacy quite a bit. So even when we've identified somebody who has what appears to be an opiate overdose, oftentimes we'll reverse them and they still aren't breathing, or we still can't get a positive effect out of them, and it's because they are oftentimes ingesting multiple different types of medications or illicit drugs at the same time. Or they think it's something else, or, I don't know that it's more frequent and it's happening as an accidental as much as it may be simply that they just don't know that it's as potent as it is. So there is that factor too.
Great.
And one of the biggest challenges, right, is it's absorbed through the skin, right? So for a lot of them, you don't have that issue, but because fentanyl, right, can be on surfaces of things and you inadvertently touch it, right, you can be exposed and issues that way. So that's one of the real dangers of it for sure.
Thank you for that. All right, we have a question at the microphone.
I have a question. I was hired recently to do a film on the opioid crisis by a group of people in Colorado who have 12 methadone clinics there, and they recently tried to open 2 more. They had grants to open 2 more clinics, and nobody would rent office space to them. They said, not in my neighborhood. And they've had problems with that issue, that people don't want treatment centers near high schools, for example. Like in Denver, for example, they opened a treatment center that was a few blocks away from a high school, and people in the community were very angry about that. So how do you deal with the stigma that, we need treatment centers, we need accessibility to them? Do you experience that here, that there's problems establishing treatment centers that are near schools, or that landlords don't want to rent to you, or that not in my neighborhood kind of thing?
All right, I'll turn that to our treatment folks, unless...
Pretty much, there's another treatment center that we're going to be opening up in Oxnard pretty soon. As far as the stigma of methadone, when I first got into the methadone field about 8 years ago, yes, even the medical doctors didn't want to deal with us. But with the more exposure, the more awareness of what's going on, the doctors, everybody's more open now. As far as I see it, we're more accepted, the treatment, and then they see the outcome of the patients and the success rate. So I think it's being more accepted. The main thing is awareness, and people know, ask questions, find out what's going on in your community, find out where it's at. And me, since I got there, we've changed it. We got security at the clinic. We make sure there's no loitering, there's nobody hanging around. They're there for treatment, and we make sure that they get the best treatment that they can and that we can provide.
I do have a question about methadone. Once somebody is on methadone, do you consider that it needs to be a lifelong treatment?
No. At our clinic, we get them off of the illicit drug, get them on methadone, and then we start tapering them off of methadone at a slow and safe rate that, like I said, to taper someone off of methadone, it has to do with their social environment, their work environment, their relationships. It has everything to do. Everything's a trigger. So we make sure when we do counsel them, we counsel them in every field and get them stable as we can. And then the patient will come to us and start de-escalating. If you guys have any questions, I have George here, one of the employees. He's has the highest success rate of patients that he counsels that gets off methadone. He can answer a bunch of questions for you after too.
I love that. Thank you.
Thank you. Okay, we have on the left side here some folks queued up for the microphone. Go ahead. Oh, excuse me. Yes, one more piece of input.
Just briefly, in terms of stigma, and I think that's a really important question, one of the things that we're battling is exactly what Ms. Ortiz said, and it's changed dramatically over the years. And so what we're trying to do, especially now that the federal government has allowed just about everybody with a DEA license to write for buprenorphine and Suboxone, is to get as many people out there to do that in a safe way in an office-based environment. And we're making inroads, and we're continuing to do that. So we're battling that stigma.
Thank you. All right, so, and I will just say regarding stigma, I think it was said well by our panelists and by our subject matter experts. The more we have these conversations openly and people understand what happens here and what the factors are leading into this dependence, they may have a little bit more context or a better idea of why treatment needs to happen and where it's going to exist in our community. So thank you for that. Okay, sorry for cutting you off there. Go ahead for your question.
Yeah, thank you very much. My name's John Tausig. I'm a refugee from Los Angeles, so I'm fairly new to Ventura here. I'm with an organization called Foundation for a Drug-Free World, and it's an education organization. It's the largest non-governmental drug education program of its kind anywhere. And so I'm not here to advertise it at all, but I have some interest in it. And so I was moved. I'm moved by these talks that parents gave with regard to their children who had experienced drug addiction and right to the end. And it must be so painful for them to try to attempt to get them back on the road, and then it doesn't happen. And I recall being a teenager, I think it's time went off and you're kind of rebellious and you're hanging around with friends of yours, and I used to sneak behind the school boathouse and smoke cigarettes so I can kind of see how it is for young people, maybe not necessarily to pay a heck of a lot of attention to what their parents are telling them, and it's a hard thing for them to do. So schools naturally would seem to have a very important role in educating young people about the dangers of different drugs, and especially now the opioids and fentanyl. I'm wondering one thing. I saw in the Coast website, which I was very impressed with it, I just studied it yesterday. I was very impressed with it, and there are numerous places where it just stresses the importance of parents to be just educating, telling their children about drugs. And no doubt this continues to be a very important thing. But I want to know if you think schools could be doing more on this. There was an interesting note in the website about this natural high curriculum. I wonder how that's working, if it's working in our schools, what's going on with that. I'm wondering if any statistics are kept. I don't know if it would be possible to do this, but if any statistics are kept about how many kids in high schools in Ventura County are taking drugs. I don't know how you could possibly know this, but perhaps there's some figure relating to this, and I'm just wondering how effective it is. And this is just one last part to it, okay?
Sure. We're taking notes. He's writing it down. All right. So go ahead and finish your last part there, sir, and we'll have Ray.
The very last thing is just looking at it how it seems like it ought to be. Why can't all of the schools here just say, good, we are going to teach drugs. We are going to teach people about the dangers of this epidemic here. We are going to teach them about it. We're going to, and there are lots of materials about it. We have excellent materials about it. We're nonprofit. I'm not trying to promote it at all. But why can't it be done? And I know there are different kinds of barriers, but what could be done at least toward this ideal?
Great. Thank you for those questions. So we had 3 parts that I was keeping track of those, Ray. If you want to take those as the education, I think Don might have some, it sounds like, too. Go ahead.
Okay. Remind me if I miss a part in the answer. But in regards to the education, as I mentioned earlier, we do have a health class, and there are some state requirements within that in which we attack yearly. Every freshman student gets a health class. And in there is the lessons and components related to drugs in a preventative way too, the conversations, guest speakers are brought in, our school resource officers will do presentations in those classes. And so an effort at information, education, and prevention is made. The question in regards to data, there's a thing called the CHICS survey. And most of the schools in the state of California do participate in it. And in there, questions are asked to the students anonymously so that they can give free answers, feel free about their answers and not be afraid to answer. And in there are a series of questions about drug use and patterns that come out and kind of lead a picture for us as we review that data each year. And then it helps us as we formulate what we need to address in regards to providing supports and services through our wellness center to attack if we see an increase in certain behaviors and or use of different types of drugs or alcohol. And so then we can curtail our resources that we have, our budgets, to get the resources we need to further educate the students in different parts of our campus and with different ways.
Right, thank you. And, there was a question, well, why can't we just teach this? Why can't we just go ahead and do it? And I think there are, as Ray had alluded to, and you can correct me on this, we have educational standards that we have to meet and instructional minutes, and there's certainly a lot of need, but very few minutes that are extra that we can do as electives or additional instruction around health and prevention. But we do have special funding, I think, for that. And I see someone to my right here who I think they brought up to speak to that if we need to. But would you like to speak to that real quickly, Ray?
In regards to requirements, and for instance, although a math teacher in a creative way may bring in a topic like this within the math, but they're a math teacher. They're focused on math, the math standards, and what they're supposed to be covering through the state frameworks and the curriculum they're supposed to be covering. There are places like health. That's why we really attack health, because there are units in there that we can address that with. There are things through social clubs we can push and have events at lunchtime to promote health and to promote prevention and against being substance. I think Red Wib and REAK is throughout the state of California too, and it's a big week of pushing, stay away from drugs, mental health supports, social emotional supports, that type of stuff. And so there are times in the year we can make big splashes, and then there's consistent opportunities throughout the year to promote that theme of what we all want, which is to educate our kids and to keep them away from drugs.
Okay, thank you for that. And we're just going to have Mr. Claros round that out to answer that, as I know that's part of what he oversees with the County Office of Ed. Go ahead.
Thank you. Yeah, my name is Jason Claros. I'm a coordinator for Ventura County Office of Education. I oversee our tobacco use prevention and vaping prevention programs and substance use service. We collaborate really closely with Ventura County Behavioral Health. I'm happy to speak to the Natural High curriculum. Our team has served, I think by the end of the year, we will have served about 2,000 students in our Natural High curriculum. It's a combination of storytelling from popular athletes, Olympians who talk about why they choose to live a sober life, like Tony Hawk and famous snowboarders, and also has those activities where we develop youth to learn skills in specific ways to not only identify symptoms of an overdose, but also learn how to say no, whether at a party or in a car or with a group of friends out on the baseball field. And we really engage them in creative ways to say no, because teens are really good at saying no all the time. We have about 95% positive responses because we collect evaluation surveys from this curriculum because we want to make sure it works well. And the other curriculum that we are going to be phasing into districts around the county is called Safety First. It's a 13-lesson curriculum that covers all different types of substances, controlled substances, opioids, nicotine, hallucinogens, cannabis, and fentanyl as well, and also has some pieces of harm reduction. So we're trying to just do the best we can to get into the schools. In any school or district that reaches out to us, we will go out and provide presentations. We can start youth development clubs that focus on prevention, and that's just all I want to share. So thank you.
Thank you very much, Jason. Okay, we're going to go to this question on this side, and then we'll come back over here. I want to point out that we are actually coming close to the end of our Q&A portion, so it looks like we had one more person queue up. I think I'm going to make that our last verbal question. Any questions that have been submitted via index card that we had come to our folks over here on the table, know that if we weren't able to get to your question this evening, which they were working to group like questions and bring the hot topics up, they will be responded to and posted on the Coast website following this event. So know that you can go back to the Coast website in the coming days and the next week, and you'll see responses to the questions that were posed this evening via index card. All right? So we'll start here, and then we'll come back here for our verbal questions. Go ahead.
Hi. Okay, so I have a question, but before I make my question, I'm going to start with my son used to have receive a service from Ventura Behavioral Health County. So 2 years ago, I never knew about fentanyl, and I never knew how you look when you overdose on fentanyl, let's call it like that. So neither the psychiatrist that was seeing my son, neither the therapist ever mentioned Narcan to have it in my house. Neither the fentanyl. When the officer spoke to me, he said that, so 2 years ago, the officer told me, 3 years ago, Ventura is going through this fentanyl epidemic. So we're talking about 5 years ago. Now, so my son was there maybe a year receiving services, and I never knew about fentanyl. I never knew about Narcan. The night before my son passed, he was like that. All the symptoms that I noticed, is that he was ingesting or he ingests fentanyl. So I was thinking, I think it was like a month ago, a month after my son passed, is that I started noticing, watching all these videos, and getting the idea what fentanyl was. And I said, why they never mention it? Maybe if I had Narcan in my house, I would have maybe done something, call the paramedics again, or help my son. But I thought it was another day that he was just helping his anxiety. And we didn't do anything. So we found my son the next day sleeping in his room. So my question is, what is the Ventura County Behavioral Health is doing right now? Are you guys telling the moms about fentanyl? Because there's a bunch of moms, there's a lot of people that are going there taking their kids because there's so much, this is an emergency now. And like this gentleman mentioned, even the day of fentanyl awareness, I took everything out in my front yard to make awareness. Purple balloons, just in front of my house, using my own money. I don't care. Why? Because my son is not here with me anymore, and I just wanted to scream, hey, listen, this is happening. Why schools are not doing this or not treating it as maybe as an emergency? I still have kids in school, and I'm worried about them. In a year, they're going to be in junior high, maybe. So my question is, like I said before, why they never mentioned me about that? Now, I think the lady mentioned that in 2016, you start handing out Narcan. Is that in schools only, or?
No, hi.
Okay. Thank you for those questions. So I think our behavioral health representatives here, we had a couple questions there, a couple layers. What are we doing around this? And then I think the last one there was, how are we distributing naloxone or Narcan? So I think this evening is one example of trying to have this conversation come more publicly. But if you can, Raina, talk a little bit more about the county's efforts on this.
Yeah, sure, I will. Thank you for your question, and yes, absolutely. So traditionally in behavioral health treatment, there's been substance use disorder treatment and there's been mental health treatment. And there's been lots of reasons why they haven't communicated with each other or kind of combined their treatment. A lot of it has to do with different confidentiality regulations. But we know that at Ventura County Behavioral Health, and so we are really working on Dr. Vlaskovitz, who talked earlier, he's got a really big campaign right now getting psychiatrists to not only test, so test for substances with toxicology testing, and then once someone is identified with having a substance use disorder, then providing treatment in that office and not referring them to somewhere else. And so I think traditionally what's happened is psychiatrists have just treated mental health, and then substance use disorder professionals have just treated substance use. And when somebody has that co-occurring disorder, that they get kind of lost in those in the cracks. And so we at VCBH 100% know that, and it's really one of our focuses right now is just to make sure that wherever anyone ends up, if they're in a substance use disorder treatment provider or in a mental health provider, they're going to be getting a toxicology test to see if they have fentanyl or other substances. They're going to be offered Narcan and fentanyl test strips and other harm reduction supplies. And ideally, those psychiatrists are going to prescribe not only psychiatric medications, but also medications for addiction treatment. And it's just slow. Unfortunately, the epidemic is a lot faster than the systems have been able to keep up, but I think we're on the right track. And here's Dr. Dennering for some more on that.
First, I want to say thank you for sharing your story, and our hearts go out to you and all the other families who've been touched by this. And just to add to what Raina said, another piece is we're here together talking about this, but behavioral health, the county behavioral health department, we only see a small fraction of everyone. And so that's another piece of it, is that this is a larger healthcare and medical, kind of like challenge that we're all facing. And so that's part of the work that we do in the Coast Group is we have the primary medicine there. We have the Medi-Cal managed care plans, so Gold Coast. We have commercial insurance getting on board. So there's a range of options and services that are now just catching up to the demands. I think it's actually the reverse in that the county system is actually much farther ahead than the commercial system and the private insurance world when it comes to substance use, especially with adolescents. And we work very closely with VCOE, as Dawn mentioned, and as Ray mentioned, connecting folks who first present at the wellness centers. Again, something in our county, we're actually quite ahead of statewide. It doesn't mean that there's not more work to do. There's always work to do. We're always going to, try to get 100% of folks who actually want services or don't even know that they need services, at least on the radar. But it's going to take a whole lot of hands, which is why we're all here tonight to talk about this. Because if we don't talk about it, then we don't know to go ask your pediatrician on a visit about certain things that you're seeing. Or you don't know to tell your child when they go in to talk to the doctors on their own, hey, these are the things you need to ask about if you're concerned about your mental health and wellness. And so it's not just waiting until they reach severity to get to county level services. And so that's part of what we want to talk about today and help people understand the various pathways into treatment.
Thank you, Dr. Dannering.
And then the last part, the question that you had was about schools. Again, I know it's not easy to share your story out in public, and again, thank you for sharing. That yes, the law was passed in 2016 that allowed schools to be able to have it on campus for anyone, any person suspected of having an overdose, which, as mentioned, it does take a law to require or allow us to, as schools, to have that, just as it required a law to be able to combine substance use and mental health together. So grateful for that. We do have also parent classes that Oxnard Union High School does through our Wellness Center also, and we send that out through our Parent Square notices. So I know for Oxnard Union High School District, and I can only speak for our district, is that we do provide parents information through the Parent Square and do have parent classes in the evening.
Thank you, Dawn. And I did promise 2 last verbal questions in the time we have left because we are almost at time. And thank you again for that question. One last follow-up for our staff here. If we have a list of the school districts who have passed naloxone on campus policies, I think it'd be great to post on the website too if we have that available, and our VCOE folks can help us with that as well. Okay, so we have our last 2, and then we'll have some closing remarks from our panelists. Go ahead.
Thank you. So I have the burden and the privilege of being a caregiver for someone who has entered the VCBH system as a teenager, has struggled with addiction. I found her nearly dead by the grace of God, and I don't know what. I'm lucky that she's still breathing. She's actually on one of the monthly injections now, working full time. So there is hope for everybody, and everybody should have naloxone in their property. I'm going to reiterate that. My question to you guys is there any plan? Because I want to set a little context. I know what to look for, right? You see somebody falling asleep pushing a shopping cart, you want to check on them. So I'm at Target in someone else's car, don't have anything except my keys and my ID. I see a Target employee and I say, where is your naloxone kit? Where is your overdose kit? The guy goes, what? I said, I need to know where your overdose kit is. I'm pretty loud at this point. I'm in the front. Nobody knows where it is. They're like, oh, well, we could talk to the manager. I said, you don't understand. There's somebody out there whose life depends on somebody getting naloxone to them. So I made them go find a manager. What I would love to know, is there any plan for like a location on a store, a sign, self-help dispensers, anything for these shopping centers, Target, Walmart, that house our unhoused community. My daughter, thankfully, is living in one of the sober livings in town, and doing really, really well. But, tomorrow isn't promised for any one of them, but I just want to be able to help. I want to know, okay, where is it? Because there are people who aren't afraid to use it, but they don't know. So is there a plan for the businesses to require it? Any stickers? Can I put some? I have the label of an Narcan box taped on my mailbox because everybody's afraid of these places being in their neighborhoods. But I am not kidding you. There are hundreds of sober living homes all over this county. There's one right down the street from me. I want them to know Narcan is available. You know what I mean? I want these people to know I have it. So I have it taped to my mailbox. It's like, is there something? Is there something we can do?
Okay, and I will actually defer to Jaime first on this one as far as community availability and for naloxone.
Yeah, so I know that there's a lot of initiatives that are ongoing. I know at the county level, and I don't want to speak for them, so behavioral health could probably chime in on this one. They do have a program set up now where they're putting naloxone right next to AEDs and in a little plastic box as well. Many of the cities, including our own, are working towards that and having them available at some of our places where you're going to likely use it, places that are forward-facing to the public, like the library and so on. There is challenges around statutory issues at the state level that have inhibited previously, and there's been a lot of change in the last year that makes things more available. But to provide some context, it took an additional, I want to say it's almost 2 years before some of your professional rescuers were allowed to use Narcan when the general public was allowed to buy it at Target. And it's stunning. We had to jump through a lot of hoops at the state level to add that just to the basic scope of practice for EMTs. Our police officers, as public safety first aid folks, have to jump through an immeasurable number of hoops whenever they administer Narcan. So those barriers are starting to come down, and they're getting better about coming down. And I think that the general conversation around this now, people are becoming more comfortable with talking about Narcan, is helping quite a bit. But I'll defer the rest of this time over to behavioral health because I think that they could probably speak more broadly to like public
Well, I think
availability.
we're actually going to have a slide in just a few moments that reminds folks that there are resource tables outside, including tables or information on how to access naloxone for general public and for the community members. And if there's places like private businesses that you think should have it, you can talk to those owners of those businesses or those property owners about these programs as well. So I'll have folks reminded about that. And then we'll go ahead. Thank you again, Jaime. We're going to go to our final question for the evening, and then we'll have some last words from our panelists. Go ahead.
Hi, I'm a parent here from Oxnard High School, and we have Oxnard High School, Hueneme High School, and Channel Island High School. They're pretty old, and I'm just wondering, is there any way that we could bring up the bathrooms up to date in regards of smoke detectors? Because I'm telling you, marijuana is being smoked in there, and the kids go in there, and even though they don't want, but they're being used in all the bathrooms. So I'm just wondering, have you guys thought about bringing the bathrooms up to date to these old high schools that we have here in Oxnard and Port Hueneme?
Great. Thank you very much. I'll defer to our school folks on that one.
We have looked into some tools as that does things like that, and we have talked to some districts that had implemented, and what we came away with is that they weren't catching kids doing that. They were just having the alarm go off continually, and the decision so far has been then, instead of spending money in that way, to put it back towards educating the children. And so, and using that money in that way to be more proactive, preventative. Now, what we do in regards to try to keep drugs off campus, try to monitor, is we have campus supervisors who randomly, continually through the day are going through the restrooms. We have searches once a day at a random classroom where backpacks and the students are searched. They won't know what classroom. And so these are random things. We have a contract with Gold Coast, a canine company that comes randomly to search the school. And so we do these things and the kids can see it so that, to be a deterrent as much as possible, But unfortunately, some kids will still bring things on campus and do things like that.
Great, thank you very much. Before we get our parting words, can you give a round of applause to our panelists on the Q&A portion? And again, if you submitted a card that we didn't get to, and I see we have a couple of them on here still, and some really good questions, we will have those posted on the Coast Ventura County website for you to review later. And if you have one more question you just thought of, feel free to turn that in before we finish for the evening. Okay, so now what we're going to do is just one last ask of the public, the folks who took the time to be here this evening. And I would like to ask each of our panelists to share a few words about what all of us can do to help them in their respective sectors. What can we do to help education? What can we do to help healthcare? What can we do to help first responders, et cetera? So I'll start with Ray. What do you think the public can be doing, or what should we be doing to help you all in education be able to do what you need to do and be preventative and help folks in this situation?
Obviously, my profession, my position is unique and sees things from a different lens, the lens of education, of being with kids daily, having been at the site myself over the 28 years as a teacher, as a coach, as an assistant principal, as a principal. One of the common things I think that we need, or common things I see too, is that we need a partnership with parents, a really strong partnership of open and honest communication. And my recommendation to many of the parents over the years has been, it's okay to be friendly with the child, but don't be their friend, be their parent. And what do I mean by that when I tell the parents those, when I have these tough conversations with them? It's that I have to be the bad guy sometimes. I have to set the rules. I have to say no. And I have to be able to let them know that I'm going to search their backpack anytime I want to. I'm going to go through their room anytime I want to. It's my house. I pay for everything. I know that's an old saying our parents probably told us, right? But it's true. And why did they tell us that, and why do we say that to our kids? It's because we want to protect them. We want to watch out for them. We want to keep them from stepping in it. And sometimes they need us and want us to give those boundaries, but they'll never admit it. They'll never admit it. So what we need is to work with each other. I would say as parents, we should be watching out for basic, simple things like, is there any change in their dress, hair style, hair color, friends they're hanging out with, attitude, behaviors, smiles? Is there any changes? Grades, have grades went down? These are factors that should raise red flags for you. I would make an appointment to see an administrator as soon as I could if I started to see some of these things happening. I would ask them, can you tell me what you know about my kid? Can you tell me, let's go over his attendance, his grades, his behavior. Have you seen him in your office? Can you give me some information? This is what I'm thinking I'm seeing at home, and I'm confused. I don't know. Maybe we can put the puzzle together. I might even ask for an SST. It's called a student study team, in which a group of people get around the table to discuss what's going on with the child. And one of the questions, if something does come out about it, I would ask the kid directly, why? I want to ask the why question. Why are we doing this? Why are we behaving like that? Once I can ask that why question and I get an honest answer from that kid, then I can throw supports and services at that why. And now I'm going to make a difference because we're addressing the why.
Thank you very much, Ray. I think you might have said words for everybody on there.
I know, just dropped the mic there.
I know. Let's go to Dawn in the few minutes we have left and the folks we have left.
I will go quickly. I just want to thank everyone that's here today. It is so important that we as a community, we are part of your community. They are part of your community. We are all together in this. And thank you for those that shared your stories. It is your voice and your stories. If you haven't shared it, continue to think about sharing it in public, because that is how our system improves. That is how we can, as a community, work together to improve the system. Get in the lock zone, keep it on you. get trained. We need to reduce the stigma related to substance use, and so that if we're all carrying naloxone, if it's part of the conversation, so that we can improve treatment services, we can improve access to services, but making sure that your voice is heard, and thank you for coming tonight.
Thank you, Don.
All right, so that'll be tough to follow. So what I would probably ask is that folks advocate as much as possible for these sobering centers to come into the county and for some of these secondary services. There is a lot of options that are starting to emerge. Things like community paramedicine, or we can start transporting people. Instead of taking them to a hospital, we can take them to some of these sobering centers. We could take them to, other kinds of mental health facilities. But those things are inhibited by the fact that we don't have those resources here, so the infrastructure has to catch up. So I would definitely ask that people advocate for those things so that we can bring these other programs to the county.
Thank you.
One thing, I agree with everything Ray said. The main thing is have open communication with your children. Parents, educate yourself on addiction. It is a disease, and it's not a choice just to stop. You need help to stop. The main thing is that as a parent, when we counsel the patients, a lot of them, they gave the parents the signs that they needed help, but the parents never, caught on to them. They're more in denial, especially being from the Mexican culture. We kind of suppress stuff, and we don't want to know that our kid's on drugs or whatever. We kind of, oh, you're okay, just get over there, you're good. Be aware of whatever your kid's doing. Their behavior changes, their grades, everything Ray said, he was right on point. When we counsel them, we get that straight out, that they reached out to their parents. They tried to let them know they had a problem, but without saying it, and the parent just didn't listen or turned the other cheek. It has a lot to do with awareness and, be the bad parent. Don't be their best friend. Go in there, hey, I'm gonna check your stuff, I'm gonna check this, because actually they are asking for it. Every kid needs structure. Everybody, even me, growing up, I needed structure. I had it, and I chose to do wrong, but then I came back, and I knew what right was wrong. But at the same time, just be aware. Come to stuff like this. Call the clinic. I'm willing to answer questions all the time. Whatever you guys need after this, if you need to talk, I'll give you my card. Just be aware and just be involved in every aspect of your child's life. And don't be scared to ask questions. They're going to get mad at you. That's part of being a parent.
Thank you. Okay, and then our asks from James Ramos. Thank you, James.
Yeah,
go ahead.
Absolutely. As I've sat here tonight, thinking about my experience, right, being in recovery, being a parent, somebody that has struggled with addiction, somebody that has seen, right, people close to me die because of drugs, and being a parent, right, I have that fear that many of you have. Many of you that are here tonight are probably here because, right, addiction in some way, shape, or form has touched you directly or indirectly. And it is, right, this is something that is an epidemic. And it is touching people's lives, and we're losing people faster than we can save them. And as I sit here and I think about what can I do or what can we do better, right? First and foremost, I think about not wanting my daughter to go through the challenges and things that I went to. And so how do I do that as a parent? How do I educate and help my daughter and my two sons not go through the challenges that I went through with addiction, right? And they touched on it a little bit, right? It's about communicating with our children. It's about, right, homes are the best place that we can really have, right, this education and experience with our kids. We need to create safe spaces. I know for me, as I look out at the times that I've struggled and been an advocate in a positive way, and times that I've really pulled away and not been able to connect with my kids and those who are trying and seeking recovery, it's creating that safe space, right? It's creating those opportunities and those conversations that we have to have. And it's hard, it's challenging, it's scary. But the reality is, this is how we do it, right? How I said yes to come tonight and to speak out. It's because this is where we start, right? We have to have, as everybody has echoed tonight, we have to start having these conversations. So we don't continue to lose the people that are closest to us. And so that's why that I'm here tonight, is continue to have those conversations, continue to meet people and love them where they're at. Addiction is hard. It is hard for those that are close to us that go through it. And so we just have to really reach out to them, meet them where they're at, and love them, be willing to sit with them, and walk with them at whatever pace they need to walk with until they get through it.
Thank you, James. Thank you. And can we give one last round of applause to all our panelists here? Thank you. All right, so we are at time here. I am going to just give you some quick reminders. Our resource tables outside will be here for just a little while longer. Please visit them. They have some important information, including information we heard from our subject matter experts. I know Ventura County Office of Ed has a table, as well as a naloxone informational table. So please visit our resource tables. And can we give them all a round of applause for being here this evening? And if you yourself or you know someone who is struggling with substance use or with addiction, help is available. The Ventura County Access Line is up here, and it is a resource that is available 24 hours a day, 7 days a week. And I did ask the question, can you call on like Christmas night and someone will answer? And they said, yes, somebody will answer. So I called. No, I'm just kidding. I didn't call. But yes, 24 hours a day, 7 days a week, there is a person on call who will answer the phone and help someone with the first steps in finding out what treatment is and how it's available. So know that this is available to all Ventura County residents. And lastly, our thanks again to all who helped make tonight possible. Certainly our panelists and our resource table agencies, our subject matter experts who are down here in the front row as well, and tonight's interpreters who are here interpreting in Spanish in real time. Thank you to the parents who shared their voices in the video. Yes, it's a special round of applause for them. Much appreciated. Our host, Pacifica High School, the Oxnard Union High School District, and Tom back there in the control booth, who's been helping with the lighting and everything. And then tonight's sponsor, Coast Ventura County, who you don't see them, but they are moving all over the place tonight, getting all of these logistical pieces in place. So I want to thank all of them again. Can we give all these folks on this slide and everyone a round of applause, including all of you for being here tonight and dedicating your time.
And our moderator. Thank you.
Oh, thank you, James. Okay, one last ask before we excuse everybody. We have this QR code here, which is a survey for tonight's programming. There are also hard copies available if you would prefer to do that as you walk out. And know that this is important information because it helps the Coast Ventura County folks and behavioral health folks know what went well and how they can always enhance and improve these types of programs. So we please ask that you scan the QR code or take the survey on your way out on paper form. So with that, I will leave this up. Thank you again to our panelists. Thank you all. Hope you have a great evening. Please visit our resource tables out there. If there's churros, help yourself again. But again, thank you all very much. Have a great evening. All right. Can we bring them?